Good day, everyone. Today we'll be discussing training current employees. Together with me is Mr. Leo Andetbonhe and Ms. Umika Shrestha. Training current employees is a critical function of human resource management, especially in healthcare settings, where patient safety and quality care depend on staff competence. Employee training refers to planned efforts by the organizations to facilitate the learning of job-related knowledge, skills, and behaviors. In healthcare, this includes clinical skills, communication, technology use, and adherence to policies. Ongoing training ensures that nurses and healthcare professionals remain competent, adapt to new technologies, and provide evidence-based care. It is not just about learning new skills, but also maintaining standards and improving patient outcomes. This is our presentation objectives. By the end of the presentation, the audience will be able to explain the importance of training current employees in healthcare organizations, describe organizational responsibilities in training healthcare staff, identify laws and regulations related to employee training in healthcare settings, discuss barriers that might affect continuous professional development, and lastly, explore strategies to support ongoing employee training and competency development. Overall, this presentation aims to highlight how effective training supports both employee performance and quality patient care. Training as a human resource management issue. Training is a key function of human resource management and plays a vital role in organizational success. Human resource departments are responsible for ensuring that employees develop the knowledge and skills needed to perform their roles effectively. Training helps maintain workforce competency, which is especially important in healthcare where professionals must meet strict standards of practice. It also supports organizational goals by improving efficiency, productivity, and quality of care. Training programs contribute to improve employee performance and overall organizational effectiveness. In healthcare, this means better patient outcomes, fewer errors, and a competent workforce. The importance of training in healthcare. Training is especially important in healthcare because professionals are required to perform complex tasks that demand specialized knowledge and skills. Continuous training supports patient safety by ensuring that healthcare workers follow proper procedures and reduce the risk of error. It also enhances clinical competence, allowing professionals to deliver safe, effective care. Additionally, training promotes evidence-based practice, ensuring that care decisions are based on the latest research and best practice. Ongoing education helps healthcare professionals maintain professional standards and adapt new technologies and advancements in healthcare. As supported by the Canadian Nurses Association and Health Canada, continuous training is essential for maintaining high quality care and improving health outcomes. Organizational responsibilities for training. Healthcare organizations have a responsibility to ensure that employees receive appropriate and ongoing training. This includes training staff on new equipment, technologies, and procedures to ensure safe and effective use. Employers must also ensure that employees demonstrate competency in the roles, which may involve assessment and evaluation. Another key responsibility is supporting continuing professional education, allowing staff to update their knowledge and skills over time. Providing proper training not only benefits employees, but also improves patient safety and the overall quality of care. Investing in training leads to better healthcare outcomes and safer practice environments. Healthcare is always evolving. Introduction of new technologies such as patient monitoring systems, diagnostic equipments, and electronic health records or EHRs are some of the examples that training is needed when a new equipment is introduced. When new equipment or technology is introduced in healthcare settings, proper training becomes critical. Healthcare workers must be trained to use new tools safely and effectively to prevent errors and ensure patient safety. This type of training may include hands-on demonstrations, simulations, or guided practice or vendor-led instructions. It is important that staff are given enough time and support to become comfortable with the new equipment before using it independently. Failure to provide adequate training can lead to misuse, increased risk of errors, and compromised patient care. Therefore, organizations must prioritize training whenever new technologies are implemented to ensure safe, efficient, and high quality healthcare delivery.
Competency assessment. After training, healthcare workers are tested through demonstrations and evaluation to ensure they can provide safe and effective care. This includes skills demonstration, supervised practice, and performance evaluation. According to Canadian Nurses Association and Registered Nurses Association of Ontario, maintaining competency ensures safe and effective patient care. On this slide, I will be talking about the laws governing workplace training. Healthcare employers must follow safety laws and provide proper training to ensure a safe work environment for all staff. Important legal frameworks include occupational health and safety legislation, workplace safety policies, and employers' duty to provide safe work environments. Canadian Centre for Occupational Health and Safety stipulates that employers are responsible for providing proper training so workers can perform their job safely. Infection prevention and safety training. Healthcare employees must receive training related to infection prevention and control. This involves practices and procedures that stop the spread of infection in healthcare setting, protecting both patients and healthcare workers. Safe equipment use means handling medical tools and devices correctly to prevent accidents, injuries, and infections, ensuring both patient and healthcare workers' safety. While emergency response procedures are the steps that healthcare workers follow to quickly and safely respond to urgent situations, protecting patients and staff. This training is essential to ensure the safety of both patient and healthcare staff. Professional standards and continuing competence. Healthcare professionals must maintain competence throughout their careers. Professional standards emphasizes lifelong learning. It is an ongoing process of developing knowledge and skills throughout a healthcare professional's career to provide high-quality patient care. Continuing education involves formal training and courses that helps healthcare professionals to update their skills and stay current with their best practices. Evidence-based practice means making clinical decisions based on the best available research, clinical expertise, and patient preferences to ensure effective and safe care. Healthcare professionals must continually update their skills throughout lifelong learning and evidence-based practice to provide safe and high-quality care. Barriers to continuous training. Healthcare organizations often face challenges in providing continuous training. Common barriers include staff shortages, heavy workloads, limited financial resources, and resistance to change. For example, a busy hospital unit may struggle to release nurses for training sessions due to high patients' demands. These obstacles can restrict access to professional development opportunities for healthcare workers.
This slide highlights the impact of training barriers in healthcare. When training opportunities are limited, employees may lack confidence in using new technologies or updated practices. This can lead to hesitation, errors, or inefficient care delivery. As a result, patient safety risk may increase because healthcare workers might not feel fully prepared to handle complex situations. Additionally, the overall quality of healthcare may decline due to updated skills or inconsistent practices. Therefore, continuous education and training are essential to ensure healthcare professionals remain competent, confident, and capable of providing safe, high quality care as emphasized by global health organizations. Strategies to support continuous training. Flexible training schedules. It allows staff to learn at their own pace, which is helpful for busy healthcare workers. Online education modules make learning more accessible and convenient, especially for those working different shifts. Effective method is simulation based training, which gives staff hand on practice in a safe environment, helping them build confidence and skills. Mentorship program also provide guidance and support from experienced professionals, encouraging growth and knowledge sharing. Benefits of employee training. This slide highlights the positive impact of effective employee training in healthcare. Training program helps improve patient safety by ensuring that staff have the necessary knowledge and skill to perform their duties correctly. It also reduces medical errors as trained employees are more aware and careful in their practice. In addition, training increases employee confidence, allowing them to work more efficiently and make better decisions. This leads to improved healthcare outcomes and better patient satisfaction. Overall, training strengthens both healthcare professional and organization. As supported by the Canadian Patient Safety Institute and the World Health Organization, continuous training is essential for delivering safe and high quality care. Key insights. Training current healthcare employees is essential for maintaining professional competence and ensuring high quality patient care. Healthcare organizations must focus on three main areas. First, they need to provide structured training programs so staff can continuously improve their skill and knowledge. Second, they must follow regulatory requirements to ensure safe and ethical practice. Third, it is important to support continuous professional development so healthcare workers stay updated with new practices and technologies. These actions not only improve healthcare quality but also enhance patient safety, which is top priority in any healthcare settings. Connection to human resource management. This slide shows the connection between human resource management and employee training. Human resource management plays an important role in supporting training in healthcare organizations. First, it helps by organizing professional development program, ensuring employees have opportunity to improve their skills. Second, it involves assessing workforce competency, which means evaluating whether staff have the right knowledge and abilities to provide safe and effective care. Third, it supports organizational improvement by aligning training with the goals of healthcare system. Overall, investing in training strengthens workforce performance and improves the effectiveness of the healthcare system. These are the references for our presentation. Thank you.